How much weight is expected to be gained in pregnancy? It depends on your BMI. So if you are underweight, as in say less than 18 BMI, you are expected to gain 16 to 18 kilos of weight in pregnancy. Whereas if your BMI is say from 19 to 28, 29, that also is acceptable, 10 to 12 kilos of weight gain in 9 months. And those who are more than 30 BMI, they would gain around 6 to 8 kilos of weight in 9 months. Now, this weight generally in first trimester, some people will lose weight, some people will gain maybe a kilo. So for the first 3 months, 3 to 4 months, people don't generally gain weight. After that, every month you're gaining 1.5 to 2 kilos, and that's how you will spread it out and gain around 10 to 12 kilos over 9 months. Now, this weight gain which is happening is not of the baby, not just of the baby. It's also including, like, it's the uterus which is growing, as in the whole uterus bag. It's like a muscle bag, and the water around the baby, the size of the baby, the placenta of the baby, the swelling of the breast, the swelling of the body, your blood which is like expanding, all of that is adding up to the weight. Like, all your organs literally swell a little bit, they become slightly bigger. So that's where all the weight is going, because when you deliver and your baby is like 3 kilos, where patients would wonder, like, how did I gain so much weight? Like, this baby is just 3 kilos. Because yes, it's all these other things that are compounding and adding up to the weight of the pregnancy. So when the baby comes out, the only things which literally come out is the baby, the water around the baby, and the placenta. The rest, all the organs still stay inside. So it takes time for you to lose weight. And so there is something after delivery which happens, is called involution, and that happens over 6 to 12 weeks, wherein all the organs which had expanded, which had grown, they start coming back to the normal size. Now they will start coming back to normal size naturally also. They come back to normal size, like the uterus literally, which was like until your under your breast, it becomes shrinks in 6 weeks. It becomes this small, and the biggest hormone which is responsible for doing that is oxytocin. So oxytocin gets released when you're breastfeeding, but it also gets released when you just hold a baby, you're staying around the baby. So all of these factors help you lose the weight. Now, if you are someone who has not gained weight in first 3 months or is not gaining weight, that's something which we need to talk about, and we can focus around meal planning and what you're eating, what you're not eating, and work around that. Also, if you're someone who has gained a lot of weight, like in first trimester, there are so many patients I see who gain suddenly a lot of weight purely because they're trying to cope with nausea, vomiting, and they're eating a lot of sweets to control the nausea. So there are ways to figure that out too. So if you are someone who is gaining a lot of weight suddenly, it can be just not because of eating, but also because of the blood pressure, the salt in your diet, and all of those components which is adding up to the swelling in the body. So all this weight which is gaining is not necessarily fat. Okay, it is, of course there is some fat which is growing in the breast, but it's more or less water weight, and your body swells up, blood swells up, organs increase. So it's all of that. So if you want to monitor that and don't want to gain too much, or don't want to like not gain and just be healthy, come on the coaching call and get coached and tell me. I keep a record of what you're eating at least for like few days, so that I have an understanding of what you're doing exactly, and we can work from there. So come on the call.